is Angela Morton. Good morning, Angela. How are you?
Good morning, Luke.
Good to see you this morning.
Good to see you too.
These months just are flying by. What have you been up to in the last couple weeks? You've been busy.
Yeah, and I try to remember where we left off because we have new
there's
grants
no-
each time.
Yeah.
So we have grants, federal grants that are serving rural Northwest Pennsylvania, specifically Crawford and Venango counties, and the Corey area. And we since have been awarded another grant for overdose response, overdose prevention. And that is a 1-year grant that we're trying to do some initiatives to educate the community and get resources out to people for overdose prevention, everything from more Narcan or naloxone for overdose reversal to fentanyl and xylazine test strips, because if you haven't heard those words, fentanyl has kind of replaced heroin in pressed pills and powder form. So fentanyl has kind of taken over, and that's a really dangerous opioid. And there sometimes is xylazine, which is an animal tranquilizer in the drug supply. So we're providing test strips to be able to test the drug supply that's out there and keep people from dying.
I think we were talking a little bit about this last time. Is there a lot of research in the reasoning for switching? Is it just easier to get, easier to hide? I mean, what's the sort of the process and why people have been switching over to this?
Do you mean the drug supply?
The drugs, yeah.
I don't know. I can't speak to that. I'm not an expert on that aspect of substance use. I can just say that what we know and what we gather from research around drug trends, that sometimes it's availability. So something becomes more available, or people perhaps start to maybe fear what's in the drug supply and switch to something else. But also people who are maybe using opiates might use a stimulant to kind of lift them back out when they get too sedated from an opiate. So they might use methamphetamine or cocaine, or the other way around, where I think I've talked to you about overamping, where somebody uses cocaine or methamphetamine or prescription stimulants and they get too elevated, and enough days of that, somebody using like methamphetamine and not eating and not sleeping and not drinking water, and you can actually become psychotic in extreme cases. So sometimes people will use another substance that might bring them down, so to speak. So unfortunately, coroner's reports often show there's not just one substance involved in a death. It's usually polysubstance.
Now, we're coming to that time of year, too, where for a lot of folks, it's a happy time. For some, it's not. How much of the stress of this time of year can play a role in triggering certain things with folks?
That's a good point that I think you brought up around like the holidays, like 4th of July too. That holidays they're a nostalgic time for people who might be missing those who've been lost. They're of course celebratory in society, and social media sometimes puts a lot of pressure on that because people are putting all the pretty pictures, not the family arguments, and then it makes it look like everybody in the world is doing better or has more or is celebrating more, and it can be a lot of pressure. But for somebody who is using substances, maybe trying to use less or not use or get into recovery, or maybe they're in early recovery and abstaining from using substances or using fewer, that the stress of all of that societal pressure, family pressure, all of those things can contribute to stress in general can contribute to that. But yes, it can impact a person's path to recovery.
Now, there's a lot of events, meetings that people can take part in to learn more, to maybe be engaged and have a chance to ask questions. November, it doesn't seem like it slows down. There's listening sessions, there's trainings, there's a lot happening.
Maybe you have the website in front of you, don't you?
Yeah, I do. Yes,
you're always good about that.
Well,
so,
for folks who think, is it once a month? Is it? I mean, there's stuff going on weekly. It seems like.
With our training series, for sure, I think we've got 3 or 4 different training offerings, virtual training every month. I think we're booked up into the spring with people who volunteer their time to share their expertise, to talk about everything from the basics of understanding addiction to screening and brief intervention, referral to treatment. QPR is question, persuade, refer, suicide prevention training. So we have a lot of trainings, but we also have community meetings and trainings for, I had mentioned when I came in, the certified recovery specialist training that's happening in December in Venango County, because I've mentioned before that recovery, it's not as easy to do alone. So when you're trying to navigate these difficult days of recovery and trying to find supports, we know that when you have support in recovery, the outcomes are better. So we're hosting or supporting the existing classes in Crawford, Venango, and Erie County to build that peer workforce. So peers who have experience in either using substances or with family or friends or loved ones who are using substances. So we have a certified recovery specialist class for anybody who wants to be a CRS, a certified recovery specialist, and the CFRS, a family recovery specialist. And that's happening in December. So the website, recoveryisnwpa.org, the site that you're on right now. If you don't see the class on there, I have to add it, but I think it's there somewhere.
Okay. And what's great is most of these are virtual, right?
Yes.
So you could take your lunch break. You could, sit at home. I mean, there's a lot of opportunities here to make it convenient for you to take part in these.
The training series, in particular, those are all virtual. The CRS or CFRS training is in person, and a person would need to commit to attending all of those.
Okay.
So I think it's maybe like a Friday, Saturday, Sunday, the first weekend of December, and then Saturday, Sunday, Monday. So people who are working might have to miss a Friday or a Monday for 3 weeks in December, but we've designed it to do on the weekends so that people could hopefully arrange childcare and transportation and around their work schedules to do that.
Who should take advantage of these opportunities? Who should sign up for a class?
That class in particular, or any trainings?
Any trainings. Maybe talk a little bit about, I guess the folks who should maybe have a better understanding of what's going on.
I think everyone should
Okay.
have a better understanding of what's going on. It's why you have me here once a month. And each time I'm, going through and seeing what we've talked about, or in general, we want to talk about substance use and have people understand substance use and addiction better. In the medical community, in the behavioral health community, we're trying to reduce stigma in general, but sometimes even within, I've talked to you about how there's still stigma. People who don't necessarily know or haven't had training, they may just think addiction is addiction. You made a choice. This is just a behavior. You can stop. It's a character flaw or a moral failing. Substance use disorder is a legitimate condition. And when people treat it as a legitimate condition, whether you're walking into an ER or you're talking to your doctor about it, it's a legitimate medical condition. And if everybody in society and in the workforce understood that, we would talk to people with better compassion around that and be able to say, you have a legitimate condition, let's see what we can do to help you through this.
A lot of folks have been having the conversation in the last week or two after the passing of Matthew Perry. And he's somebody who has stated in many interviews that he wants to be remembered for his ability to help others. And he has stated many times with his struggles, it's a disease. It changes you. And you have been saying that for a long time. For people who don't understand, if somebody's addicted to alcohol, drugs, it changes the chemistry of your mind changes. Maybe talk a little bit about that.
Well, so you have celebrities who I always revere and remember and honor that they have a voice and a platform to share this. And I watched his, Diane Sawyer interview, I think within the past year, 6 months or a year, and listened to him talk about that and thought, for every celebrity or somebody who has a platform and has a voice, they say it and people hear it. And the more we do that, the more we can meet people where they are when they are in that state. Now, if you have supportive people around you who are understanding, non-judgmental, and just there to help, it might mean that those choices that are being made in the thick of the disease maybe aren't the optimal choices and aren't choices a person would make when they're not using substances. So there's another famous comedian who talks about his recovery, and I love listening to how he says, I watch interviews of when I was completely under the influence, and it's not really even me.
Yeah.
Because I was changed so much by my substance use. So
I think that was Matthew Perry, too, where he could see episodes and not remember doing it or what happened in it.
And friends and clients I've worked with over the years will say that there are things that maybe drive that substance use. So one of the number one risk factor for substance use and why we do substance use prevention in youth and in families is trauma. So trauma and unaddressed mental health, a lot of people will find out the first time they take a prescription or a pill or have a drink or smoke a joint or a cigarette or anything that alters, there's something that clicks, and everybody's a little different, brain chemistry, family background, genetics, that at some point a person could say, I remember one of the first times I took XYZ and it made me not feel anything for the first time, or it made me feel things that I thought everybody else was feeling. So there's either an approach in trying to feel something, or there's an avoidance in trying to avoid feeling pain and trauma. So it all starts somewhere, and it does start with a choice. I'm not pretending there is no personal choice about it, but if we're being realistic and scientific about it, it's a condition that is treatable.
That's a point to a lot of this stuff, right? You've had that long, stressful day at work. You're supposed to, in the ads, go home and have a beer and just relax, or have a glass of wine and relax. The stresses of life, here's something that's going to, help with that. It's just when one or two becomes 6, 7 a case, that's. I don't think you've ever said it's not okay to not partake, right? But where's that line when you should start to think, oh, maybe I am having a problem?
I think that line is different for everybody. So I don't know when you had said that. I think you were going along the lines of how complete abstinence isn't always the aim. There are people who say, I just want to get off of all substances and never need anything again. But we're really trying to promote awareness that recovery looks different for everyone.
Yeah.
If we judge that one way is better than the other, people are not going to get help. So I'm pretty passionate about low or no barrier access to services and meeting people where they truly are. If somebody's using let's say a large amount of fentanyl, and they come in and they're like, hey, now I'm only using 1 pill a day for the first time in 3 years. That's reducing harm and saving their life. So there are people that would say, well, just quit if you're only on that one. But when your brain has been changed and then you crave and you're having withdrawal, it's life altering. You feel not just sick like the flu. People explain it's like sick beyond any sick you can imagine, and you're driven to make that feeling go away. So that's where medication-assisted treatment, or medication for opioid use disorder or alcohol use disorder, there's medication, there's treatment. So if someone says to their doctor, I've heard there are medications that can help me get into recovery, and to talk about that. And if that doctor, nurse, care provider doesn't listen or isn't a proponent, ask somebody else. Keep talking about it. Research it yourself and take some notes and say, do you know any doctors who prescribe this? Because I've heard that this can help me. And I do a lot of telling people to advocate for themselves too. I think that's important.
The other thing that comes out when you have a celebrity who passes, you don't see sort of the chain reaction of the folks that they've touched or helped over the years. I guess what I'm getting at is, behind the scenes, there can be a lot of people involved in helping somebody in their recovery. Somebody that's there for them, somebody that can listen, somebody that can give them a ride to where they need to go. But you don't realize that sometimes when you just see the person who's struggling. And again, not to go back, it's just been in the news a lot with Matthew Perry. You've got a lot of people that have come out and said, again, other celebrities, and you go, I didn't know they were struggling. But you see this and you go, yeah, he helped me. He told me I should go to this clinic. He told me I should go here. He gave me a ride someplace, or we had a conversation. He was just there to listen. these are things that you've been saying too. Sometimes you just need to sit back and instead of lecturing somebody, say, I'm here just to listen. I can give you a ride. Tell me what you need, and I'll be there for you.
It's
That
why,
sounds really corny, but
no, it's why it is exactly. It's in a nutshell everything we should say every time that I'm here, because you know how whenever I leave here I thank you profusely, like thank you for doing this. You have no idea. I mean, really,
Yes.
I leave
Yes.
here like almost groveling, like thank you for this opportunity. Thank you for like giving us this platform to talk about it. Thank you for even caring to talk about this, because the more we talk about it, the more people will be able to say, we don't have to hide in shame over this. We can come forward and we can talk about what we're dealing with, what I might be dealing with, what our neighbor or friend or family member might be like silently dealing with, because it's under this like shroud of shame and guilt. Because when there are people speaking negatively about substance use, you now become a place where that person can't talk about it. So if we want to be part of the solution, can you tell I'm getting up on the soapbox now? If we
Yeah.
want to be part of the solution, then we need to speak to people with kindness and understanding and compassion. And if they get defensive and say, hey, back off, quit talking to me about it, you've done your part and you're a person who is safe. You're a person who, if they decide they want help, they can come to you. And it could be anyone. It could be the radio show host asking the right questions. It could be a probation or parole officer, a police officer. I've talked to people who said the way that officer treated me was the reason I wanted to get help. Or I had two officers. One was screaming and yelling at me and treating me like a terrible person, and the other gave me a glass of water and said, let's just let you collect your thoughts. And in that moment, you feel like a human being, and somebody's treating you like you deserve to live and to get help. That goes a long way. So you can ask every person in recovery, where was that tipping point? Was there somebody in your life? And it might have been that person who offered me a ride and didn't judge me when I was a mess, or the person that I disclosed to when I said, hey, I'm early in recovery, that didn't judge and said, but you keep doing your job. You're doing great. Thank you for sharing that with me. But you're you, and I accept you as you are. Instead of, wow, really, I never knew that about you, like it was this big secret. That if we can just talk about it more often in a frank and accepting and compassionate way, people can come forward and get the help that they want or need when they're ready.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel. Angela Morton with us here this morning. Do you see an increase this time of year with folks looking for help? Are there patterns that you can follow, or is it pretty random?
I'm not, because I don't run any of our clinics. I can say just from working in the field that there are times of year where we could say, hey, intakes really drop during a certain time of year, whether it's early in the summer versus the holidays. There's an uptick, or after New Year's. It's similar to any trend that people go to the gym for the whole month of January and 2 weeks in February, and then I think gym membership goes down. So there are trends.
Kind of like a conversation during COVID was, all the stuff dropped, domestic violence, but did it really drop, or was it just because people weren't out and things were still happening behind closed doors, and you find out, well, there's more of that than anything. But yes.
So yes, there can certainly be trends, and I think that if we kind of circle back to what you were saying about the resources that are available, we try to provide all of those resources year-round, so that maybe when there's a lull in treatment providers' schedule, not that happens very often, but they would be able to say, hey, I can do a lunch and learn. I don't even have to turn my camera on. I can listen into this doctor who's talking about eating disorders and substance use, or understanding differential diagnosis around ADHD, because that sometimes is overdiagnosed, and there are other things like trauma or anxiety or autism that could be misdiagnosed as ADHD. So we do education year-round to try to support the workforce, but there are some times where it's really hectic and we don't get anybody to show up for a focus group. We almost always have a really good turnout for these trainings across the region, but I think I don't know that I've even mentioned that the grants are called Recovery is Community NWPA, and the website at recoveryisnwpa.org has all of these things that we're doing, from training to education about how to access Narcan or naloxone, how to get drug disposal, or where to drop off unused prescriptions, because We don't want them to get into the wrong hands or be misused by somebody they weren't prescribed for. So there's all these resources, all the things we can talk about. And yes, there are upticks in the need for those resources, but they can be utilized anytime.
We're down to the last minute and a half or so. Anything you want to mention?
Well, just to keep plugging away, if you know somebody who's struggling, be as non-judgmental as possible. And if you happen to approach them and say, I'm somebody you can talk to about anything, might be the only thing you say.
And maybe not around the Thanksgiving table?
Definitely not. That's a one-on-one kind of conversation. Because if I had diabetes and was like eating a diet that was really bad for me and was sending me back and forth to my doctor or to the hospital, and I had somebody at the dinner table saying, hey, look what you're doing that again, it's not going to be productive. Meanwhile, if somebody pulled me aside and said, I'm worried about you, you've been at the doctor's a lot of times, or you've been in the hospital 3 times now, I'm here for you. And I'm not judging. It's your choice. But those words don't always land well either. I mean, when you have a family member or friend, and I've been in a position where I've had those conversations, they don't always land well, even when I'm not judging. So you have to know when to back off and know when to offer the services, or even just to leave a magnet or a card or a website around for someone to look into the resources. But I always think it's important to reiterate that treatment is available regardless of your ability to pay. So if there's somebody out there who thinks, hey, maybe I need to talk to someone, it starts with one phone call. You can call right here in town at Family Service and Children's Aid Society. They have mental health and substance use services. You can call your county drug and alcohol office in any county. You can call and just be screened. Just have a conversation without even necessarily saying your name. It's just a phone call. If that phone call feels right to you, they may offer you an assessment and say, yes, it sounds like you maybe qualify for some services. Let's get you in here and connect with the county to get your services paid for, or get you the behavioral health managed care. Treatment is available regardless of whether you think you can pay for it or not.
Angela, thank you. Good to see you.
Thanks so much.
Take care.
You too.